I was trying to get rid of this small screen which is blocking the note. Maybe then at that time accidentally I have muted. So until which part you all heard?
You you didn't start clopidogrel.
Oh my God. I actually 2 times I explained the process. Okay, anyway. So when I moved the note also, you all didn't tell me anything. Okay. Okay, clopidogrel. So clopidogrel is also a prodrug, right? So I think I have now 5 minutes or more I have done muting myself, right? So ticlopidine is a prodrug. So clopidogrel is also a prodrug. And it also similarly inhibits the P2Y12 receptor on the platelet, right? And it is also closely related to ticlopidine. But the difference is only about 15% of absorbed drug undergo metabolic activation. That means if we give 100, only 15 molecules will be there for the action, right? So we know the prodrugs, they become active by the liver metabolism, right? So when we use this type of a drug, and if we also use another drug which inhibits the liver enzyme responsible for the metabolism of this prodrug, what could happen?
Liver toxicity can happen.
Pardon me?
Liver toxicity can happen
How?
when metabolism is reduced. Uh, the drug can be accumulated and become toxic.
But drug is not there.
Uh,
So this is a prodrug, right? This is a prodrug, right? So to get the action, this should be converted to active drug. So this is happening inside the liver, right? So what are the responsible thing is the liver enzymes, right? Hepatic or liver enzyme, right? Is it clear?
yeah.
Okay. If we give another drug, we know certain drugs has some effect on these liver enzymes. Some drugs can induce, some drugs can inhibit these enzymes, right? So if we give a drug which can inhibit this enzyme, what will happen? Namidu? Namidu, are you there?
Prodrug,
Hmm?
the prodrugs concentration accumulation will be there.
Drug accumulation
Will be there.
will be, come again, Sarah?
Prodrug accumulation will be there.
Okay, prodrug will accumulate. Okay.
Yeah.
So what does that mean? But what is important aspect of here? We don't mind prodrug getting, yeah, there can be certain some, but it does not have any action, right?
Yeah.
What is most important thing here?
The drug what is given.
Hmm?
The drug what is given.
Hmm. Yes, I understand the prodrug will accumulate, but
Yeah.
that is not the major concern because prodrug doesn't have any action. It can slowly excrete, right? But what is the major concern here?
The mechanism of action of the drug won't be there. So the
Mechanism.
purpose of the drug is not there.
Why? Why the purpose of the drug is not there?
Blood, uh,
Somebody else? Why others are not speaking? Janani, Hiroshini, Namindu, are you there? Janani,
Yeah.
Jayani, yeah. Namindu, Namindu is not there. Hiroshini is also there. Yeah, Jayani. Yes, this is what you can simply see here, right? Yes, what is Sarah is saying is also true, but that is not our major concern because prodrug, it will accumulate, it will not give you much of a harm, right? Because it doesn't have any action, therapeutic action, right? But it will not convert because we solely depend on this conversion for the effect, right? For example, if we take paracetamol, we know the paracetamol molecules are there. So somehow we will get the effect, right? If the metabolism is less or this enzyme is inhibited with regard to paracetamol, okay, paracetamol can get toxic. Yes, then at that point, that is the major concern. But here, we will not get the effect because we don't have active drug, much of active drug, right? So, these liver enzyme inhibitors, if we are taking these type of other drugs which inhibit the enzyme, or else if the patient has a disease condition where the liver enzymes are not working as expected, right? So then those things can cause a treatment failure, right? Treatment failure. What is a treatment failure? We give the treatment, we give a drug, but still not get a effect or a response, right? So that is a treatment failure. So for this type of drugs, treatment, there's a risk of treatment failure if there are other drugs, right, in the liver. Therefore, C19 poor metabolizers may be at risk of treatment failure with clopidogrel, right? So is it clear now? Sarah, is it clear to
yeah,
you?
yes, miss.
Okay. So there can be a treatment risk of treatment failure for this type of drugs. And since clopidogrel is like, especially for clopidogrel, because if we give 100, only 15% is metabolized, right? That means only a small percentage is there. So then the risk is higher if the liver enzymes are not functioning properly, right? Okay. Now, clopidogrel appears to be safer and better tolerated than ticlopidine. So this is important, safer and better because it doesn't have a lot of side effects like the ticlopidine, and also it is better tolerated. Although irreversible inhibition of the P2Y2 receptor is more potent, but their effect is more potent, right, than ticlopidine, but it is safer and better. Most common adverse effect is bleeding with rare occurrence of thrombocytopenia and leukopenia. Use of CYP2 C19 inhibitors such as PPIs may decrease the antiplatelet effect of clopidogrel, but this theory remains controversial. Avoid concomitant PPIs if possible, right? Because PPIs are this particular enzyme. This is like not cytochrome P450. This is a cytochrome 2C19 enzyme. So that is converting or metabolizing the prodrug of clopidogrel. Therefore, PPIs are inhibiting this enzyme, therefore better to avoid this combination. It is not proven yet, but it is better to avoid, right? And then we are moving to dipyrimidol. Dipyridamole interferes with with platelet function by increasing the cellular concentration of cyclic AMP. It is also a vasodilator and used in combination with warfarin for prophylaxis of thromboembolism associated with prosthetic heart valves. It is also used in combination with low-dose aspirin for an ischemic stroke or transient ischemic attack to reduce the risk of future or further strokes. Adverse effects: GI, dizziness, headache, hypertension, hot flushes, and tachycardia. So just one moment, I need to check something. Me about the dipyridamole mechanism of action, please. Can Hiroshi explain me? Sharmila, Janani, can someone explain me dipyridamole? bleeding, bradycardia, hypertension, and so these antibodies inhibit the platelet receptors where fibrinogen goes and bind, right? So if the antibody is not bound within 30 minutes, like it excretes, half-life is about 30 minutes for abiximab. But when it is bound to the platelet, the action is last for like 18 to 24 hours. These other two agents, eptifibeptide and tirofiban, they have a longer half-life compared to abiximab, unbound half-life. But when it is bind to the platelet, the activity is shorter than abiximab. Is that clear? Is that clear? Glycoprotein 2B 3A inhibitors කියන drug category එකේ අපි drugs තුනක් mainly කතා කරනවා abiximab, eptifibetide, tirofiban, right? So abiximab තමයි usually commonly used වෙන්නේ. මේවා monoclonal antibodies, right? එතකොට මේක fibrinogen receptor එකට bind වෙනවා platelet එකේ. ඒ bind වුණාම තමයි antiplatelet activity එක එහෙම නැත්නම් platelet aggregation එක නැති වෙන්නේ. Trabiximab bind වෙන්නේ නැතුව අපේ body එකේ තියෙදි 30 minutes වලින් වගේ clear වෙවි යනවා half life එක 30 minutes. අනිත් drugs දෙකේ 2.5 hours. ඒගොල්ලන්ගේ unbound half life එක abiximab එකට වඩා වැඩි. ඒ වුණාට bind වුණාට පස්සේ abiximab අපිට 18 to 24 hours action එකක් පෙන්වනවා. නමුත් action එක අනිත් drugs දෙකේ ඊට වඩා අඩුයි. ඒක දැන් තේරෙනවද? පැහැදිලිද? ඔයාලා
Yeah, clear.
ඉන්නවද? Hello?
Yes, miss, it's
Yes,
clear.
miss.
Okay. So, this is a different class of drugs, different mechanism of action. And this is not usually used alone. Make a good emergencies well like percutaneous coronary interventions well IV infusion වලින් only once දෙනවා. එතකොට තව අනිත් drugs වල junk therapy එකක් විදියට පාවිච්චි කරනවා. Right? Trabiximab තමයි usually ගොඩක්ම පාවිච්චි වෙන drug එක. ඊළඟට දැන් අපි දැන් මෙච්චර වෙලා කතා කරේ the drugs that will affect the platelet activation and aggregation. Now we are moving to fibrinolytic system. That means how when there are blood clots, right, in the body, we have a system to dissolve it. After the repair of the injury, it will dissolve, right? So the fibrinolytic system. So we also need that uh, process in certain cases, like when there is a ischemic heart disease or stroke, and if there are blood clots, I mean, embolism is happening, thromboembolism is in that patient. So we can use this type of system to dissolve the blood clots. So once the damage to the limb is repaired, the fibrin thrombus must be removed to restore the blood flow. Release of tissue plasminogen activator or TPA from the cells leads to the conversion of plasminogen into plasmin. Plasmin has the capacity to digest fibrin in addition to fibrinogen. The formation of digested degradation products act further as anticoagulants, but the fibrinolysis is controlled by the inactivation of circulating plasmin by protease inhibitor of alpha-2 antiplasmin. So what is, let's summarize that. Mhm. And I'm searching for my pen. Uh, okay. Right. Now the blood clot is here. Now once it is repaired, the injury, we need to remove it to maintain a good blood flow. Right? I think it is clear to everyone. Right? So how it happens is what explained here. Now it will release tissue plasminogen activated, TPA, will be released, and this will convert plasminogen into, plasminogen is in our plasma, right? It will convert to plasmin, right? This TPA will convert plasminogen into plasmin. So what will plasmin do after that? So plasmin will digest fibrin, right? So fibrin will be break down or digest, right? So by that process, we can remove this clot. We can break down this clot and remove the clot, right? Is it clear? පැහැදිලිද?
Yeah.
Yes, miss.
Okay. Um, okay. So in the body, what will happen is after sometimes we need to inhibit plasmin as well. දැන් මේ plasmin fibrin dissolve කරනවා. ඊට පස්සේ අපිට මේ plasmin වල action එකත් නවත්තන්න ඕනේ. ඒක කරන්නේ කොහොමද in the body? අපිට තියෙනවා protease inhibitor sorry alpha 2 antiplasmin right antiplasmin එකක් තියෙනවා antiplasmin එකෙන් plasminම inhibit කරනවා right අන්න ඒ වගේ action එකක් තමයි යන්නේ අපේ body එකේ right අපි දැන් බලමු අපි ඒක කොහොමද drugs වලට use කරන්නේ කියලා මේක තමයි අපේ body එකේ සිද්ධ වෙන normal procedure එක right ඒ process එක පැහැදිලිද
Yes.
දැන් අපි blood clot එකක් හැදෙන විදිය කතා කරානේ මේ clotting factors ඇවිල්ලා blood clot එකක් හැදිලා sorry fibrinogen fibrin වෙලා ඊට පස්සේ platelet එකතු වෙලා adhesive වෙලා aggregate වෙලා පස්සේ thrombus එකක් හැදෙනවනේ හැදිලා ඒක block කරනවා bleeding ඊට පස්සේ dissolve වෙන විදිය තමයි අපි මේ කතා කරේ tissue plasminogen activator TPA ඇවිල්ලා plasminogen plasmin කරනවා plasmin digest කරනවා fibrin ඊට පස්සේ plasmin inhibit වෙනවා antiplasmin වල. එතකොට අපි fibrinolytics ගත්තොත් drugs to dissolve the blood clots are known as thrombolytics, fibrinolytics or plasminogen activators depending on their mechanism of action. එතකොට plasminogen activators, TPA activators, endothelial cells secrete tissue plasminogen activators at the site of injury. Physiologic TPA is a serine protease and fine like blah blah blah. You don't want this much of information, but to have some understanding, if you wish, you can go through. So what will plasmin do? What happens is plasminogen activator will be released. It will convert plasminogen into plasmin. Plasmin will digest fibrin and right? So this family of thrombolytic drugs are used in acute myocardial infarction, cerebrovascular stroke, pulmonary embolism for acute myocardial infarction, even serious block strokes, heart attacks, pulmonary embolism, ඒ වගේවට මේ class එකේ drugs use කරනවා. So drugs තමයි atiplase, recombinant tissue plasminogen activator, එතකොට retiplase, altiplase, altiplase, retiplase and tenecteplase. Okay. So altiplase is a recombinant form of human TPA. It has a short half-life, usually administered as an intravenous bolus followed by an infusion. So you can go through these three drugs. It's not very hard to understand. So can someone tell me what is a thrombolytic? Thrombolytic එකක් කියන්නේ මොකක්ද අපි? What is a thrombolytic?
Drugs that are used to dissolve the blood clots.
Okay, drugs that are used to dissolve a blood clot or a thrombus, right? So tissue plasminogen activators. අපි tissue plasminogen activator එකක් දුන්නාම කොහොමද මේ drug clot එක දිය වෙන්නේ? What can be the mechanism of action of tissue plasminogen activator?
Convert plasminogen to plasmin, and the plasmin digests the fibrin.
Come again, Sarah.
Convert the plasminogen to plasmin, and the plasmin will digest the fibrin.
Yes, exactly. Right? So that is the mechanism of action of tissue plasminogen activators. So what are the examples? What are the examples for tissue plasminogen activators, the drugs? Example එකක් කියන්න. Altipase, retiplase are examples, right? Now, There's another thrombolytic drug which is very commonly used. Then heart attack එකක් වගේ හැදිලා ගිය serious කෙනෙක්ට මේ වගේ drug එකක් දෙනවා streptokinase. Streptokinase given by IV infusion is used in acute myocardial infarction, arterial and venous thrombosis, and pulmonary embolism. So streptokinase is antigenic because it is derived from beta hemolytic streptococci bacteria. හරිද? එතකොට මේ streptokinase වලට allergic reactions එන්න පුළුවන්. Streptokinase is antigenic because it is a product we extract from a streptococci bacteria. So it has no intrinsic enzyme activity, but form a complex with plasminogen, produces a conformational change in plasminogen to expose its active site and facilitate the formation of plasmin. This drug is rarely used in clinical practice for fibrinolysis. Urokinase is sometimes referred to as the urinary type plasminogen activator because it's formed by kidney and is found in urine. It has limited clinical use because, like streptokinase, it produces considerable fibrinolysis. However, it is used for pulmonary. So this drug is rarely used in clinical practice in the sense what it means is like as a regular drug. දැන් මොකක් හරි disease එකකට අපි day to day දෙන regular drug එකක් විදිහට streptokinase use වෙන්නේ නැහැ. ගොඩක් වෙලාවට emergencies වලදී තමයි අපි use කරන්නේ. This is urokinase non-antigenic, but it is expensive. So administration altiplase should be given within 6 to 11 hours of symptoms onset of these myocardial infection, stroke, and other indications that we talked about. Streptokinase within 12 hours of symptom onset, but ideally should be administered within 1 hour. Tenecteplase should within 6 hours of symptom onset. Altiplase, streptokinase, and urokinase can be used for deep vein thrombosis and pulmonary embolism as well. Absolute contraindications to fibrinolytic therapy: previous intracranial hemorrhage, known cerebral vascular lesion, known malignant intracranial cancer, active bleeding, significant head facial trauma within 3 months, suspected aortic dissection, ischemic stroke within 3 months. Adverse effects, common adverse effects of all the thrombolytic drugs is bleeding complications related to systemic fibrinolysis and lysis of normal hemostatic plugs, right? So this is normal hemostatic plugs will also break down. The bleeding is often noted at a catheterization site. Although gastrointestinal and cerebral hemorrhages may occur, therefore, stroke are not usually, Therefore, patients who have experienced trauma injury or who have a history of cerebral hemorrhagic stroke are not usually administered thrombolytics. Rethrombosis can occur following, like, I don't think this is very relevant to you all. So only thing that you should know is anticoagulants such as heparin are usually co-administered and continued after thrombolytic therapy for a period of time. So we talked about now fibrinolytics, and there are inhibitors of fibrinolysis as well. So what are those drugs? Aminocaproic acid, a lysine analog that competes for lysine binding sites on plasminogen and plasmin, blocking the interaction of plasmin with fibrin. Right? So මේ aminocaproic වලින් කරන්නේ blood clot එකක් දිය වෙන්න නොදී තියාගන්න. දැන් fibrinolytics වලින් අපි කරන්නේ අර අපේ body එකේ normal process එකක් තියෙනවානේ. blood clot එකක් හැදුනම ඒ blood clot එක දිය කරලා යවන. ඒතර fibrinolytics වලින් කරන්නේ ඒ process එක simulate කරලා blood clots අයින් කරන එක. එතකොට inhibitors of fibrinolysis කියන්නේ blood clot එකක් සාමාන්‍යයෙන් අපේ බොඩි එකේදී දිය කරලා අරිනවා. ඒ දිය කරන එක නවත්තලා තියෙන එක තමයි inhibitors of fibrinolysis. ඒ කියන්නේ clot එකම තියන්න හදන එක තමයි inhibitors of fibrinolysis වලින් කරන්නේ. එතකොට ඒකට examples තමයි aminocaproic acid. ඒකෙදි කරන්නේ ප්ලාස්මිනුයි ෆයිබ්‍රිනුයි ඉන්ටරැක්ට් කරන්න දෙන්නේ නැතුව ඉන්නවා. ඒ කියන්නේ ප්ලාස්මින් තිබුණොත් එයා ගිහලා ෆයිබ්‍රින් ඩයිජෙස්ට් කරනවා. එතකොට ප්ලාස්මින් බ්ලොක් කරනවා ඉන්ටරැක්ට් කරන්න දෙන්නේ නැතුව ෆයිබ්‍රින් එක්ක. right? So it is absorbed rapidly after oral administration and used to reduce bleeding after prostate surgery or tooth extraction in hemophilia. ඒ කියන්නේ hemophilia is a disease where they don't get blood coagulation or clot formation. එතකොට ඒගොල්ලන්ගේ bleeding control කරන්න මේ වගේ drugs අපි use කරනවා. ඒ වගේ කෙනෙක්ගේ tooth extraction එකක් කරොත් එහෙම නැත්නම් මොන හරි surgery එකක් prostate surgery වගේ කරොත් ඒ bleeding control කරන්න මේ bleeding එක නවත්ත ගන්න අපි මේ fibrinolysis drugs use කරනවා. It can be given IV as a loading dose or over 1 hour and then as an infusion until bleeding is controlled. It can rarely causes myopathy and muscle necrosis. So we have another drug. This is aminocaproic acid, tranexamic acid. Tranexamic acid, it's also lysine analog. So this compete to the binding site on plasminogen and plasmin. This also block the interaction of plasmin with fibrin. This can be administered for same indication and aminocaproic acid including to control heavy menstrual bleeding. It is recently excreted and it is renally excreted and dose reductions needed in renal impaired patients. Yeah, that's all about it. Right? So if we summarize in today's lesson, we focused on the processes like in the blood clotting process. Today we focused on the platelet aggregation. So we discussed antiplatelets like aspirin, ticlopidine, clopidogrel, dipyridamole, and what else? Prasugrel, and there were certain other drugs also. And another different category is glycoprotein 2B and 3A, right? Then we talked about the fibrinolytics or thrombolytics, which means to dissolve the blood clot, right? In that case, we have tissue plasminogen activators like altiplase, retiplase, and also we have streptokinase and urokinase. Yeah. And there are certain drugs to inhibit fibrinolysis also. That means they will promote having the blood clot. For example, in hemophilic patients, when they are doing tooth extractions or prostate surgeries, there is a risk of bleeding. For those type of people, we use aminocaproic acid, and there is tranexamic acid. So that is used in combination with aminocaproic acid to reduce the heavy menstrual bleeding. This is not for hemophilic patient, but for anyone. If there is a heavy menstrual bleeding, these drugs can be used to stop or control the bleeding. Any question? Any question? Are you all clear with what we have learned today? Sometimes you don't
Yes,
need a lot of information, but as a summary, you need to understand what is the process, how it blocks, or what is the mechanism of drug, action of the drug. So then it is okay for you all. Are you all clear with what you have learned today, or do I need to explain it again?
No, it's
Yeah, Miss,
clear.
it's clear.
Yes. Okay, next week also we will like the latter part. I think I went little bit high speed, so we will just refresh the memory on the latter part next week in the beginning, and we will move to the other lesson, whatever the new lesson for the next week. But until that, please just read through, make a summary and read your summary and understand what happens and what are the drugs. Likewise. Yeah. So if you don't have any questions, I will wind up the session. And hopefully we will meet next week with a new lesson. That will be probably on cardiac or nervous system, because we have epilepsy as well, and also we have uh, arrhythmia and cardiac failure. Those parts also to be covered. Yeah, let's see how it goes. So yeah, we will start a new lesson next week. But this blood clotting and related drugs, please, now since this section is over, now you can summarize and you can make flow charts. මේ ඔක්කොම ටික එකතු කරලා ඒක හරියට understand කරන්න map එකක් වගේ අඳ ගන්න පුළුවන්. ඒ කියන්නේ දැන් මෙහෙම plotting process එක ලියලා different drugs ඔයගලන්ට පුළුවන් කොහෙද කොතනද act කරන්න කියලා. ඒ වගේ මේ diagram එකක් අඳින්න, short notes අඳින්න, summaries දාන්න. ඒ වගේ කරලා ඒක summary version එකෙන් මතක තියාගන්න special දේවල් ලියලා ඒ note එකේ. Right? Okay, then I will wind up the session. Thank you very much for joining. So if
Thank
you
you,
have
Miss.
any questions, you can contact me in this session. But next week also we will like spend 5 to 10 minutes to refresh the latter part of this lesson as well. Okay.
Thank you, Miss.
Thank you.
Okay, Miss. Thank you.